In some patients with restrictive lung pathologies, you may want to facilitate using their accessory muscles to breathe. One technique when doing this is asking your patient to put their hand on their chest and then trying to breathe into that hand right there. So only really try to use that upper chest to breathe. So breathe in and out. And really only use the chest. Awesome. And breathe in and out. Awesome. Another way I could do this is putting my hands on the patient's chest and allowing the patient to breathe into my hands and trying to allow the lungs to come up and into my hands. So I'm going to put my hands on your chest if that's okay. And then I'm going to be breathe into my hands right here. And out. And in. And out. Awesome. So another way we could do this is to inhibit the upper chest and only get this lower chest right here. So one way I could do this to inhibit the upper chest is I'm going to have to apply a big pressure right here, trying to push down on the upper chest. I'm going to put my stomach on the lower chest and just try to breathe into this right here. And out. And in. And out. Or they only try to use this lower chest, okay? Breathe in. Right there. And out. Try to not use this upper chest. Breathe in. And out. There we go. That was good. Good job. In order to improve the control of breathing and secretion removal, we can work on the active cycle of breathing. So I'm going to have the patient just breathe normally for 5 to 7 seconds. And then I'm going to ask the patients to do about 3 to 4 deep inhales and relaxed exhales. So let's do that. And relax. A deep inhale and relaxed exhale. Deep inhale and relaxed exhale. And now we're just going to do about 5 to 10 more seconds of normal, relaxed breathing. So now I'm just going to have you relax and breathe normally. Awesome. If we could just do about 3 to 4 deep inhales and then a couple more relaxed exhales, if that's okay with you. Let's try one more time. Deep inhale and relax that exhale. Deep inhale and relax exhale. Deep inhale and relax exhale. Great job, Felicia. Now I can just have you turn to your side and go into your arm and just huff and cough, please. Trying to get that secretion out. Good job. See, this is one way we can work on that, getting that secretion out. And when you're feeling like you have more secretion in there, just try to work in this active cycle of breathing. Felicia, I see that you're a little bit short of breath right now. One way we can work on that is just putting your arms on the table right now, and you can lean forward. Try to work on some of those breathing techniques. Really focus on that inhale and relax that exhale. Are you feeling any better?
Yeah.
See? And some positions will help you with your breathing, and this is one of those positions. To encourage lung and chest wall expansion, you can use the butterfly technique. In order to perform this technique, what I can have you do is just putting your arms on your back of your head like this. So when you breathe in, I'm going to have you just try to open up like that, and when you exhale, just come right back in and bring your head down. So breathe in, and now come right back in. And breathe in, and come up, and just come right back in. This is one of the techniques that you can use to encourage chest wall expansion. The purpose of an incentive spirometer is to increase lung volume and lung capacity, particularly in those patients with post-surgery. It's used to reopen and improve oxygenation and or prevent atelectasis. So when you're using the incentive spirometer, you're going to instruct the patient to slowly take a deep breath in through the mouthpiece while trying to keep the ball between the two markers. You're going to rest for a few seconds between the repetitions, and you're going to perform 10 repetitions every hour. You're going to want to perform 10 repetitions every hour that you are awake to help improve the lung volume and lung capacity. When facilitating the lateral chest wall stretch for lung expansion, what I want to do is I want to block the opposite side of the lungs and then turn him my way. So if I'm trying to expand his right lungs, what I'm going to do is I'm going to block his left side of his lungs right here and then have him side bend towards my way just like this. And now I'm just going to have him facilitate normal breathing for about, and we can hold this position for about 4 to 5 minutes. What I'm doing is I'm blocking his chest wall on his left side, allowing him to facilitate breathing on his right side more. Now I'm just going to have you turn your head and cough to the right. Try to get some of that secretion out. That is one way we can help with chest wall expansion. Another way we can increase unilateral chest wall expansion is doing the trunk rotation stretch. So what I'm going to do is I'm going to block one half of his lungs, and then when I'm going to rock him my way, he's going to breathe in, and when I'm rocking back, he's going to exhale. So to start, he's going to go like this and put his arms over his shoulder. I'm going to block your left half of your lungs right here. So I'm going to put my arm under your scapula, block your lungs, and then take a deep breath in and exhale. And inhale and exhale. I'm going to do it one more time. Inhale and exhale. When doing this, another thing we could do is just keeping him in that position where he's turned up and just having him breathe just like that. So I'm going to come under, block the lung, and then just having him breathe in this position is another way we can facilitate unilateral lung expansion. The tower roll stretch is another method we can use to increase the chest wall mobility and expansion. So as you can see, when I roll our patient over right here, I place a tower roll down the length of his spine. This is going to, so what we can start out is just sitting here like this and breathing like this until the patient can tolerate it. Some patients won't, this is all they'll be able to do to tolerate in their breathing, and they can stay like this for 4 to 5 minutes. And this will be therapeutic for their breathing, but for Nick, since he is a little less irritable, we can incorporate some deep breathing exercises in with this towel roll under his back. So what I want you to do, Nick, is I want you to raise your arms out to the side, just like this. And when you do that, I'm going to have you take a deep breath in, try to fill that lungs till you get over your head, and then you're going to exhale as you come right back to your body. A couple of times. So what this is going to do, it's going to help him facilitate his chest wall expansion with deep breathing. Great job, Nick. So now what we're going to do is we're going to bring our arms up overhead, and we're going to abduct them out to the side, and then we're going to bring them right back. And as you bring them out to the side, I do want you to take a deep inhale in, big breath in, and then exhale on the way back. Another method we could do is, instead of doing the vertical towel roll, is we could do the horizontal towel roll method using the same breathing techniques. So what I'm going to do is I'm going to place this towel roll under the apex of the patient's thoracic spine. So then I'm going to have you just lean right back. Awesome. Now what I could just have you do is just have him deep breathing until he's tolerated, and then I can move on to the same exercise, the same breathing exercises that we performed with the vertical towel roll. Another way we can facilitate breathing with Nick is we can use the long sit cough assisted position. So Nick, what I want to have you do is I'm just going to show you. You're going to bring your arms up and look up over the air, and you're going to inhale, and then you're going to bring it down and look down and exhale. Okay. So I'm going to have you bring it up and down and exhale. And go a little bit faster. Up and down. Okay, Nick, now next time I'm going to have you do it one more time and then cough to the side, okay? Another technique we can do to help minimize pain after surgery is using the splinted cough method. So Nick, what I want to have you do is I want you to just have you hug and hold that pillow right tight right next to your stomach. And then when you're going to help breathing, you're going to lean forward and just breathe just like that. So we're going to do a couple deep breaths just like this. And then after about 5 deep big breaths, I'm going to have you try to just turn to your side and really push pressure through that pillow and cough to your right, okay? So do one more big breath. Awesome, and now we're in. And now on the exhale, just talk through. So this is a technique you can use to help apply pressure to that abdominal wall right for after surgery to help with minimizing pain when coughing. Another way we can help move secretions and prepare for coughing is using the huff method. So Nick, what I want you to have you do is place both your hands on your stomach just like that. And now I'm going to have you breathe in just through your nose. And now when you come out, I just have you try to blow out through your mouth and try to huff, just like that. Awesome, I'm going to do it one more time, just like you're fogging up a mirror. So some deep breathing techniques that we're going to do with Nick today are the butterfly technique and then just some upper extremity movement in sitting. And then we can also perform that in supine, but for simplicity, we're just going to do it in sitting. So Nick, what can I have you do is just have you put your hands behind your head and open up a little bit. We're going to have you take a big deep breath in to start in this position. And then when you have you come down, I'm going to have you exhale and try to bring your arms down. So I'm going to, and then exhale and come right back down. Awesome. We're going to inhale, take a deep big breath in. Exhale through the mouth and come right back out. So you're going to inhale through the nose, come up, and exhale through the mouth. So like I said, another way we could do this is just incorporating some upper extremity movement in this sitting position. So what I'm going to have you do is I'm going to have you start by taking a big deep breath in, trying to open up that through the mouth, through the nose, and then exhale through the mouth as you bring your arms right back down. Inhale, and exhale through the mouth. So this is a way that we could work on just improving the chest and lung wall compliance. In patients that have poor diaphragmatic control with breathing, you might want to work on diaphragmatic breathing with that patient. So when working on diaphragmatic breathing, you want to instruct the patient about what the diaphragm is and just give them a little education about where it is. So Nick, if you want to just put a hand on your stomach right down here and take a big little sniff in, you might be able to feel that your diaphragm is contracting. Can you feel that right there?
Yeah, I feel it moving.
Awesome. So now when you breathe, I just want you to really try to use this part of the this part of your stomach to breathe and not as much as your upper chest. So you can have the patient put their hand there, or I could be the one to put my hand there and instruct the patient to breathe into my hand, like so. So Nick, I'm going to place my hand on your stomach right here, and you're going to try to breathe into my hand. Is that okay?
Yep.
So just try to really breathe into my hand right here. One more time. Awesome. So you're going to breathe in through your nose and out through the mouth. This is a breathing control technique to really get the diaphragm activated. Another way for the patient to regain control of their breathing is working on paced breathing. So if it's okay with you, I'm going to have you take a nice deep breath in, and then you want that big exhale to be twice as long as that inhale. So big, slow, deep exhale. This is called paced breathing. So she's trying to regain control of her breathing. So let's do it again. A nice inhale right here, and a deep, long exhale. You want that ratio to be 1 to 2 from inhale to exhale. Let's do it. So Felicia, I see that you're a little bit short of breath right now. One technique we can use to work on this breathing control is really trying to take a big deep breath in through your nose and pucker those lips together and try to just breathe out through those lips. This is called pursed lip breathing. So take a deep breath in through your nose and pucker those lips together and just exhale through those lips. Your patient can perform this as long as they need to. In patients that have excess fluid or secretion in their lungs, you might want to perform some percussions and vibrations with them. In the position that Nick's in right now, we are working on that middle upper, or the middle, his right middle lobe, and I'm going to percuss right over that area. With this position, I can be percussing for about 5 minutes or until the patient's tolerated. And then after the percussions, I'm going to perform some vibrations on his exhale, and he's going to try to cough and get some of those secretions out. Is that okay with you, Nick?
Yep.
Awesome. So I'm going to start my percussions just at this position right here. Depending on the patient, you might want to increase or decrease the tolerance or the pressure that I'm vibrating or percussing. Have him try to get some of that secretion out. So Nick, I'm gonna have you take a big deep breath in, and then on your exhale, I'm gonna have you cough and try to get some of that secretion out. Is that okay?
Yep.
Awesome. So take a big deep breath in and out, and huff and get some of that out. We do that one more time, okay? So deep breath in and out, and try to huff. Awesome. So. Your patient should be seated in the long sit position, leaning back 30 degrees. Position your patient supine with the table level. Your patient is in a short sitting position, leaning forward 30 degrees. Your patient should be left side lying, head down 15 degrees, and rotated 1/4 turn backwards. Your patient should be right side lying, head down 15 degrees, and rotated 1/4 turn backwards. Your patient should be prone with the bed level. Your patient should be side lying with the head down 30 degrees. Your patient should be prone with the head down 30 degrees. Your patient should be side lying, head down 30 degrees, and rotated 1/4 turn forward.